Dr. Tom Roselle live right now, 630 WMAL.
You know, I'd like to add something to that.
Go ahead.
I think Lyme's disease is often blown extremely out of proportion in one respect. Not that it's not a reality, but I think that the co-infections that occur along with Lyme's are not getting the spotlight as much as they should. In other words, Lyme's also brings friends with it. There's something called mycoplasma, Bartonella, Babesia. These are other spirochetes and bacteria that do similar things. So when you look at the Lyme's picture, although the lab test might come back normal and the person is perplexed on why they could have all this joint pain, I think it's coming back normal because the doctor's not often checking for the co-infections, which might be causing as much, if not more, of the problems, especially in chronic Lyme's.
Not only that, but when they do just a straight-up Western blot, the bands that they evaluate are limited. And you can have an exposure to Lyme's, and then this is where you go to the co-infection as well. The Lyme's isn't active, but there's other guys there. You can see that there was an exposure. They brought it with them, but nobody checks for the other pieces.
No, and
you're absolutely right.
You know, we were going to touch on a little bit later, and I'm going to kind of get into it now about the different types of functional testing that you can do to quantify a lot of these kind of gray area diseases and problems. Well, the C4A test that she had is becoming more and more popular because it gives us more insight. There's other testing that check for certain type of chemical messengers called cytokines that is becoming extremely more important.
Yeah, cytokine pathways are critical.
So especially for the ones that are inflammatory in nature, something called tissue necrosis factor alpha and interleukin 6. These are the two big heavy hitters of inflammation. Now, when these start to go above resting normal, which means that above where they should be, it comes at the cost of suppressing those cytokines that actually quelch or bring down inflammation. So very often some of these kind of tests that we don't hear about become very, very important in the big picture as far as putting together a treatment plan.
Now, when you go through the entire pathways of interleukin, why? I mean, you can go, interleukin 17, interleukin 10, interleukin 5. Why are you picking on interleukin 6? Why would how would you explain that to our audience?
Well, interleukins and this tissue necrosis factor are more or less messengers that go around the body and tell your cells what to do. So in this case, these two messengers tell the cells that there's an inflammatory response. So the cells react in accordance to that and start to fight the inflammation. Well, that comes again at the expense of the anti-inflammatory response. So we don't want to be in this situation where all we're doing is putting out forest fires all throughout our body.
Well, this is one of the T cells differentiators too, right?
Correct.
So T cells are those things that are a primary part of autoimmune response in the body. And if T cell production is suppressed, then we're going to be susceptible to almost anything.
Yes.
And so that comes to what we're talking about.
Yes, and it's been touched on in the media, but never to the extent that it should be. We heard about a book that was very, very popular in the 90s that Fats That Heal and Fats That Kill by Udo Erasmus.
Yes,
and that is a groundbreaking work for one reason and one reason only, and in my opinion. He's talking about the way those fats work as what we call eicosanoids, which are chemical messengers also.
Yes.
And these eicosanoids in reality are like upper management that controls these interleukins. So fat metabolism becomes one of the big things that we consider when we're trying to handle people who have inflammatory response. And we know about the good fats, the omega-3s, and we know about just the kind of not so great ones, omega-6s. And we really want to look closely at that ratio because we can start to control those messengers of inflammation by using our diet.
Absolutely, I totally agree with you. It's one of those things that so many physicians forget to look at. And I understand this sounds like a whole bunch of mumble jumble to the people that are listening to us, but nevertheless, it's the next step in understanding what immunological pathways do. and where the breakdowns occur. And actually, if you understand the neurological stress patterns we're talking about, you really get that picture. You really get to understand that. Dr. Harlan Browning is my guest, and he will be your host this Wednesday evening, March the 23rd at 7:30 p.m. at the Roselle Center for Healing. He's going to be talking about neurological stress patterns and how they affect the body in so many different ways. We would like to invite you. Be there, 703-698-7117. Tell my staff that you would like to be our guest, and please make a reservation because, as you know, we have limited space. Once we hit about 35 to 36 people, it's done, and we can't take any more. 703-698-7117. John, you've been waiting patiently. How can we help you, my friend?
Yes, doctor, I've been looking on a computer, and it says glass filters, but every place I call, they only have plastic filters for the water. Do you know any place that I can get the glass?
What are you talking about specifically, John?
The filters for the sink in the kitchen.
It depends on the type of plastic, John. I mean, if you're getting, there are certain plastics that are really bad. You don't want to get water bottles that, typical water bottles outside, when they're exposed to heat or cold, are going to produce something called xenoestrogens, and that's the danger. That's the stuff that you don't want in your body. But if you're using hard plastics and they're graded, and the company has a very strong reputation, I wouldn't be too fearful of it. There's some good guys out there, and there's some bad guys out there. Aquasana has a very good filter. You can go on to our website. We've hooked them in as one of our sponsors. You can go to rosellecare.com, and there's a tremendous discount for any of our listeners that are interested in the filter. But there's some that I wouldn't use. I mean, there's things like a Brita filter. I wouldn't use a Brita filter unless there was absolutely nothing else available, because it doesn't do the job it needs to do. So the reverse osmosis filters are the best. They are also the most expensive. But generally speaking, what you want to stay away from relative to plastic, John, is the container that you keep the water in, that you store the water in. It has to be very heavy, very thick, and otherwise, and you have to make sure that it's not exposed to a lot of heat or cold, and if you do that, your water should be fine. I hope that helps you. I appreciate it, John. Thank you for your call.
Okay, thank you.
Dr. Browning, let's talk about how we can tell if somebody is suffering the end products of stress.
Well, outside of their symptoms, we can do different types of diagnostic tests. And most of the time, the conventional tests that we see utilized in my practice, certainly yours and across the board, don't necessarily illustrate the fact that the person might be breaking down because of stress. So we start to look at laboratories, boutique-type labs that do specialized or functional medical testing, and we can look at areas of overall adrenal function, and there's a test called the Adrenal Stress Index test that really is an excellent place to start. It looks at our cortisol level as it courses through the day, and the test takes 4 samples, one in the morning, one around lunchtime, late afternoon, and early evening, or I should say right before bed, and it looks at the binaural rhythm, or the way our cortisol starts and ends during the day. It should start relatively high, and it should tail off towards the nighttime. This is a normal rhythm. Well, sometimes when we're under stress, that rhythm will become disrupted. So this test, this Adrenal Stress Index test, becomes a very good starting point to know where we are. If we want to explore the way the body's being broken down, then I often will look at digestive functional tests, even if the person doesn't have digestive problems. So we might want to do a specialized stool analysis. And then inevitably, food allergy testing becomes a big portion of it, because we get things into our system that our body doesn't like. It attacks it and sets up an autoimmune reaction that perpetuates a lot of problems, specifically ones that involve musculoskeletal pain.
We're going to come back and we're going to talk about that just a little bit further. Dr. Harlan Browning, my guest, your host this Wednesday evening at the Roselle Center for Healing. 888-630-9625. That's where we are right now. But to visit him, 703-698-7117. We'll be right back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We've been here at 888-630-WMAL. Answering all of your calls from a natural point of view, non-drug, non-surgical, of course. My guest, Dr. Harlan Browning, will be your host this Wednesday evening at the Roselle Center for Healing. He's going to be talking about neurological stress. If you'd like to attend the 23rd, 703-698-7117. Tell my staff that you'd like to be there. We're talking about how you actually know when you're under stress. And one of the tools that we use in the office, Dr. Browning uses, all of our staff uses, to determine inflammatory pathways, which is the primary indicator of stress patterns, particularly chronic, is thermographic imaging. Thermography shows you, like nothing else, levels and areas of inflammatory response and shows you how the body and where the body is breaking down. It's something that you should incorporate as part of your diagnostics. It'll tell you definitively that you got a problem, that you've had an injury, that you've had something going on there, and will help your doctor help you. Call Dareth Painter at 703-943-7248. That's 703-943-7248. And tell her that you want to have an evaluation for stress patterns. And trust me, this is one of the best investments you'll ever make.
You know, an interesting thing about thermography, it's really the only way that we can quantify the amount of pain that is real, because in fact, pain is a perception. The mind makes up pain, and we all have different pain thresholds. But when we use thermography as an instrument, we can really determine the extent of the inflammation, because some people might have, out of a 0 out of a 10, they might have a level 3 of pain. But when you do the thermography, the whole thing's lit up. In other words, there's inflammation everywhere. So it becomes a really good tool to help show the person that what they're experiencing is reality.
And it shows the physician areas that he may not be aware of. Things where the actual source of the trauma or the injury or the breakdown, we know that thermographic imaging will show up breast problems in the state of what we call vascular neogenesis, the beginning stages of blood supply to a tumor 5 to 8 years before it shows up any other place.
Right. And let me just add something to that. For a lot of the folks that have chronic pain syndromes like fibromyalgia, they've been through the gambit, and a lot of times the end stages, they've been told by their doctor that it's all in their head. So they've been given antidepressants or anti-anxiety meds and stuff like that. So when they come to the office and we can do the thermography and we can quantify to show them that they do have pain, a lot of times that in itself is a big first step to getting them better, because they've almost been convinced that they don't have a problem and they just need to deal with it.
Doc, you got a minute. Wrap it up. Let's tell us what they're going to learn, why they should be at that class, and, let's close this thing out.
Well, what we're going to do is we're going to bring together that chemical, structural, and emotional triangle that we talk a lot about in the office. We're going to relate it to the way the body handles stress, or maybe doesn't handle stress. We're going to talk about the classic symptoms in different parts of the body, the gastrointestinal, immune system, musculoskeletal, so we'll see how those things break down. We'll talk about ways that we can physically and chemically measure those levels, those functional tests that I referenced, and then we'll talk about ways that we can put all this back together without using drugs, without using surgery, and help a person reclaim their life.
This Wednesday evening, March the 23rd, Dr. Harlan Browning will be your host at the Roselle Center for Healing, 703-698-7117. We're here every Sunday at 12 noon, bringing you the most intimate and up-to-date information on integrative care, things that you can do to help yourself. Remember, your health truly is all in your hands. It is a do-it-yourself program. This is Dr. Tom Roselle. We'll see you next week with some more information. Hi, this is Dr. Tom Roselle. If you're looking for a wellness and healthcare environment to showcase your business, products, and services, consider being a wellness partner of Dr. Tom Roselle Live and the Roselle Center for Healing. From in-show advertising to on-site events and digital marketing, we have several offerings that can highlight your business with a well-received and established audience. For more information, visit WMAL.com, keyword Roselle, that's ROSELLE, and click on Become a Sponsor.